Hi, how's it going? Um, yeah, I enjoyed last time, so hopefully the
Yeah,
same
it's
again.
great, wasn't it? Great, yeah. So, yeah, we'll see how it flows. I think we were just saying we're going to have a bit of a chat today about health anxiety, maybe, and the fear cycle.
Yeah.
Before we hit record, we just kind of just touched on it a little bit, didn't we? We were talking about you've probably seen hundreds of patients in your clinic that have come in with health anxiety, and there's that element of fear around things. You may have given them you've given them some reassurance during your appointment, and
Mhm.
they've maybe felt good for 5-10 minutes on that drive home if they were driving home, but then the likelihood is they're probably going to be back in within a week or two with the same problem. Would you agree?
Yeah, it's tricky because, uh, as you know, the brain is a very, very powerful thing, and so it can mimic um, some diseases, and it can mimic things where there's sort of true tissue damage or true pathology going on. Um, and so the first thing that you have to do is you have to make sure that there's nothing physical going on. There isn't actually a
Structurally,
disease
yeah,
process.
yeah, yeah,
Because I know that something that kind of worries patients is like a doctor gaslighting them, and so you need to make sure that you're
yeah,
doing your due diligence and
yeah,
using your
sure,
knowledge and using various tests that you have and examinations and that kind of stuff to make sure that what tends to be a hunch at the start that it's
yeah,
very anxiety driven
yeah,
actually ends up being the case.
yeah,
Um, and it's about building
yeah,
trust within that and building confidence for your patient that they're able to trust what you're saying, essentially.
yeah,
Um,
yeah. So, yeah, I completely agree. I always put a disclaimer in my post to say, although I am talking about rewiring the brain, and
mhm.
giving people tools to overcome the problems that they're experiencing, it's always important that they do get checked out by the doctor first. Just as you say, just echoing what you said, really, to check there is no structural damage there, but I think once it's not always the case that they always need testing, is it? So it could be just investigations, but things
Yeah,
could come back clear. And we're then looking at a possible anxiety disorder, then, aren't we?
yeah,
Once we've
yeah,
ruled
and
everything out.
you find the kind of amount of tests that people need to have before they start
Yeah,
to kind of believe and have faith in the idea that it's anxiety. So some people
yeah,
just need a bit of reassurance from yourself, maybe an
yeah,
examination, and they come out
yeah,
of the consultation feeling better. Some people
yeah,
might need some blood tests. Some people might need a little bit more, and then you have the people where a true health anxiety is just this roller coaster of emotions and symptoms that get a little
yeah,
bit better, maybe after you've reassured them for a bit, but then they'll get into these negative thought cycles and they'll get much worse. Maybe they have a trigger for things, and you just go round and round in this negative feedback
yeah,
loop of worsening symptoms, worsening anxiety. And it honestly looks awful because, unlike some other
yeah.
types
It's
of
real difficult.
anxiety, yeah, it kind of, as I say, it kind of plays into itself. So your symptoms will get worse the more anxious you are, and then you'll get more anxious, and so it must be really, really awful to have these kind of anxieties. But yeah,
I,
it's a tricky one to manage.
Yeah, I think for me as well, there's obviously there's lots of anxiety disorders, isn't there? But I think health, obviously me experiencing health anxiety as well. It's a real tricky one, isn't it? It's a real difficult one for people to manage and overcome. I think as well, if you've been stuck in fight or flight for such a long time,
Mhm.
people probably haven't recognised that the brain has probably previously been trying to warn them to slow down a little bit and look at the bigger picture. But sometimes when that stress jug overflows and
Mhm.
people then experience lots of symptoms, don't they? Times muscle switching, tension, headaches. There's just hundreds of symptoms they can experience, right? Um,
Yeah, Yeah.
But again, that fuels a cycle, doesn't it? You know, I think for me, when I started out, obviously I'm a big advocate for exercise, but I think in my head, even being a health professional, maybe it's a bit of seeing people with conditions every day and family dynamics. I thought there was something structurally wrong with myself, and obviously, what I did do was it took a while, but I was able to make that link between the time that the symptoms started, between the time that things were going on in my life that were quite stressful. So making them two links, I realised why the symptoms started. But it takes a while, doesn't it, to rewire the brain? You know, and if the more you fear something, the more you reinforce into the brain that that particular activity is unsafe. It's not safe. Would you agree?
Yeah, and I think there's I mean, you're talking about rewiring the brain, which is a way to sort of treat this, but that's essentially what has happened in the first place, is that you've
absolutely
sometimes if you have something called if you have complex renal pain syndrome, for example, which is where you get a chronic pain in a position, usually that is caused by some trauma to start with. So surgery is a good example of something that can start this. So there's a pathology there. Your brain then gets oversensitized to pain there. There's a part of your brain called the amygdala, which deals with sort of fear, and that can heighten pain. It can heighten sensitivity, and then you're just getting into this feedback loop. And actually, the pathology turns into this this chronic pain, and that just continues to go when there isn't any tissue damage there where there was before. So you can still have triggers to these things. A lot of triggers that we see, if someone's family parents have struggled with arthritis in the past, that can lead to them having a higher chance of suffering with pain in the future. Similarly, if someone's mum had something terrible like multiple sclerosis, MS, then you find that sometimes when the kids grow up, they can suffer with these more functional neurological disorders and have similar symptoms. That there are ways that we can try to differentiate these things. We know that certain pathologies have very specific patterns, whereas your pains or your other fear-driven symptoms can be a little bit more all over the place and not quite fit into these patterns that we know. There are certain symptoms that people fear because, you know, it can mean something serious. So, you know, chest pain. A lot of people come in with chest pain, but that's actually a symptom of a panic attack and anxiety. A lot of people come in with, as you say, your muscle twitching or like numbness or pins and needles that comes and goes.
Tension,
and MS is something
muscle tension as well.
So there are some serious things that can mimic it, but an experienced doctor can see the patterns and see that it doesn't quite fit, and, you know, cover your bases a little bit by doing some investigations, but then try to come round to the crux that actually it's happening when you're more anxious or when there's this over stress on your entire life. And
I'm sure you'll get loads of people coming in with them symptoms, you know, muscle twitching, tension that can last, you know, months, years before they actually, you know, has there been any patients that you've seen overcome these issues?
For sure.
Or do you feel a lot of them get stuck in?
And it really does depend on a whole factor of things, including you know, certain things within their life. So there are certain disorders that aren't necessarily just purely psychosomatic and anxiety driven, but things like fibromyalgia, where you've got this central nervous system sensitivity, but is heavily linked to how much stress you have in your life. Things like chronic fatigue can be triggered by very stressful situations, and can leave people bedbound and very disabled. If you have good people around you, if you are able to motivate yourself, get out of bed, to do some exercise, sleep as well as you can, change your diet potentially, and you have the certain personality to get yourself out of those horrendous situations, then you can do well. If you don't have those support networks, if you don't have a good relationship with, a doctor potentially, or someone else who can motivate you, then you can stay in those cycles for longer periods of time.
Yeah, and it takes longer for people to then overcome and recover those conditions, doesn't it? Yeah. I often see that quite a lot with people I see at my locum job with fibromyalgia. Although I've read there's a link between the dysregulated nervous system as well, like you said, becoming desensitized, the amygdala becoming desensitized, and people more symptoms.
It definitely can be triggered or pushed forward by stress. They have done sort of MRI scans on the brain, and it does show that things are sort of flashing up when they shouldn't be. So it has shown that the brain is oversensitive to touch or to pain. And similarly, like your nerve ending is going up to the brain. It's not perfectly understood, but there are some signs that there is this sensitization of the nervous system, which, as you say, certain things can manage that. And actually, essentially, one of the first line treatments of things like fibromyalgia or chronic fatigue is CBT, is therapy. So you can see how that plays in.
And has there been any, just for people that have got the condition, has there been any people that you've seen recover, maybe by, because we say desensitizing the area of the brain?
So there's definitely people who I've seen recover through therapy, through exercise, through things that we know that are good for you. I have a patient who was bedbound from chronic fatigue who is now back to work, and that happened within the space of like a year. It can be very frustrating because you see some improvement and then want to push yourself, and then sort of one step forward, two step back.
That's brilliant. That's great news. I mean, it's that. Shall we say, it's like climbing a mountain, isn't it? It's going to be up and down. It's a journey, because again, I suppose we're sending safe signals to the brain that we're doing it. It could be we're doing something in particular. And if the brain's been a bit stuck for a while, it's misinterpreting these normal sensations, and they're actually harmless. And then it feeds that fear cycle, that fear loop, doesn't it? Oh, it's too painful, I can't do that. But sometimes you've got to experience the pain to get through it, because then you're probably reinforcing to the brain, it's actually safe. This isn't dangerous. And it's repetition, isn't it? Well, it's repetition.
And when you get yourself into the darkest of the mess, when let's say you have a pain in your back and that's just perpetuated, and maybe an MRI scan is normal, but you have this pain, and then you start to fear and you start to get a lot of anxiety around it. You'll stop work, you'll stop moving, you'll maybe stop working, you'll definitely stop exercising. And one of the worst things you can do for back pain is just sit there or just lie there and do nothing. It stiffens up, you become less fit, and that will worsen the pain. And so it's that sort of avoidance and reinforcement that sends people spiraling down. And then just physically, it's harder to recover. Not even.
It becomes a long-term problem.
Yeah, exactly.
No,
exactly.
It's that loop, isn't it? It's that loop. It's like, for example, I think at the start of my journey, I think which was the muscle twitching and the fear of a neurological condition. I think if I had stopped doing what I was doing, whether this was work, exercise, seeing people, which, I kind of did do for a little bit, but I think for it to become a long-term issue, for me, I don't know what your thoughts are on this. I think if somebody's doing that or repeating that behaviour for years, it does become a bit harder to break. But you can't, I believe you still can recover, but I think it takes a lot longer, doesn't it?
I can't remember the statistic perfectly, so I'd butcher it. But essentially, if you've taken a year off work, the likelihood of you getting back to work is so drastically small.
Yeah.
I can't remember it to say right now, but it's sort of 10-20%. We're talking about that level of difficulty. Yeah. And I think work, but other things, and you can use this as a sort of another bow to your rehab and recovery, is purpose. I think purpose is almost more important than happiness, really. If you have a reason to get up in the morning and do something, that can drastically give you motivation, drastically help. And you can use rehabilitation and your recovery as your purpose if you're not ready to get back to work, and really put everything that you have into that. And you'll find just doing that will start to unlock things and will start to help as well.
Absolutely. I think that's really important. Work's important, isn't it? If you think of these as tools, work's important, exercise is really important, diet's important, socializing is important, and then you've got the other bits and bobs, self-compassion. That's really important. Being kind to yourself, because I think when you're recovering from some of these disorders, it is frustrating, isn't it? And you are going to expect some hiccups along the way. But it's just recognizing that you can acknowledge that and say, this is difficult, this is hard, it's not easy. But recovery is possible, isn't it? That's what we want the message to be to people, really.
Yeah, and for sure. And if you think most people won't ask for help until they've been struggling for months, if not years. Yeah. And if you think everything's gone downhill for that length of time, you have to allow yourself and you have to expect the same amount of time for you to get back to normal. So if you've been stressed and that's turned into an anxiety and depression for 18 months, it could take you that long to come out the other side.
Absolutely.
Yeah, and it may be this 2 steps forward, 1 step back, and you may have good days and bad days and good weeks, good months, terrible months. Something might happen, and you will get frustrated. And yes, you do need to be very kind to yourself. You need to be kind to other people around you, because one of the symptoms of anxiety and depression is actually being quite irritable, and so you can be quite hard to be around. And so you also need to understand that and be compassionate to everyone around you and yourself, because you're just as harsh on yourself as well.
Yeah.
And if you don't do that, you can spiral as well.
Yeah. Again, it's feeding that fear loop, isn't it? I did quite a bit of, I don't know if you're familiar with somatic tracking.
Okay.
Where you kind of scan your body from head to toe, and you're just trying to be with the body and just normalize these sensations that are in your body that are safe. You're sending safe signals to your brain, and over time that can desensitize things. That's quite good. There's a chap called Alan Gordon. I don't know if you're familiar with him. Talks about somatic tracking, but it's around about this sending safe signals to your brain. But it's in a meditative way. But the right way to do it is you're not doing this intentionally to try and fix yourself. Is again, if you're trying to do it, if your intentions are to, because there's nothing structurally wrong. You're not broken. So you don't want to reinforce to your brain that this is still a problem, this is still dangerous. You're just sending safe signals to the brain that it is safe. Quite a good little technique, actually. I do on myself sometimes. When you feel a bit disconnected.
Yeah.
And you can do this exercise.
I've tried it.
As much as you
I've tried it when I've been meditating. I know you're not supposed to be bad at meditating, but I am bad at meditating. I just drift off into my thoughts almost immediately. But that's one of the ones that I do like to do, is sort of work down the body. And you really can pick up sensations that you weren't aware of. So I would imagine if you have a sort of a pathological psychosomatic pain signal going on, you can alleviate that by doing that, by sending all these signals to the brain. And I could see how that would work. I also know that there is pretty good evidence that this is useful as well.
Again, that's something that takes time, but it's really interesting actually. There's a lot of neuroscience backing behind this now. As you were saying before about the amygdala becoming sensitive to pain. So this is all good work towards the recovery really. If you're continuing to send safe signals to the brain, it can only mean good things, can't it?
Mm-hmm. Yeah.
In time, it's especially for me. I think when I was sort of at the start of my journey, it's like if I go to the gym, I'll expect muscle tension afterwards. It's normal.
Mm-hmm.
I'm going to get it, And again, like you said before, I think if somebody's been in that fear loop maybe for 12 months of fear in the body and withdrawing from things, it will take a lot, probably take double the time with this work, I'd say, to recover.
Yeah, and that's one thing that you can use as well, is that pragmatic thought process of, there is a cause and effect, there isn't a cause and effect. If you're having abdominal pain, which can be one of the harder ones to manage in primary care, because there's so many things that cause tummy pain. If you're just experiencing tummy pain and you're not experiencing any of the other abdominal symptoms, then maybe you can go, well, this doesn't quite fit things. We've had all these tests. When I had this pain and I had to go to A&E and I had all of these tests, maybe I had a CT scan, I was really well tested, I was really well investigated for this, and everything was fine. This is the symptom that I had at that point. At that point, I was reassured by all of these tests that I had done, by the doctor who explained it to me, and I felt better. So if nothing has changed between then and now, it probably isn't this cancer that's growing inside of me, because we already had that test 6 months ago, and it was explained to me at that point. And so you can bring yourself back in a sort of pragmatic way as well. And I find that using that kind of thing can help sometimes with
absolutely.
With do you just remember when we did this and we did this and we said that? So sometimes you do need reinforcement, and sometimes you do need a bit of reassurance, and that's why it's always useful to talk to people. Because that's the other thing, is that sometimes when people have health anxiety, it is their own kind of thing, and they sort of clutch onto it, and maybe they're a bit embarrassed by it, maybe they are so fearful of it or so fearful of what could be that they don't talk to anyone about it. But isolation is again one of these compounding factors that's just going to spin and make everything worse. And so chatting to friends and family, chatting to someone like yourself, chatting to a healthcare professional, I think is always useful.
Just to kind of get it out, because I'm sure, like when you see patients with that common health anxiety as well, and even if they do get sent for tests and they come back clear, you often get them coming back, with symptoms. I've still got this tension, or I've still got this twitching. Even after testing, they don't feel reassured. And what would you say the approach for people to that is? and say it's MRIs, they've had MRI, nerve conduct, but it's still come back clear. That should be enough, really, shouldn't it, to reassure the person that there's nothing structurally wrong here.
But when there's anything happening in an adult brain, the only person that is actually going to help is yourself. I mean, you can have a lot of reassurance from other people, or other people can tell you everything's okay. The only thing that's going to change your mind is if you're able to change your mind yourself. And so it's work that you do yourself, I think, that is going to be quite a big chunk of things. I mean, doctors will see people all the time who come in with health anxiety, who come in every month, every 2 weeks. You know, we have, I don't know, 20,000 people on our NHS books, and you only ever really see the same 200 people. And a lot of it isn't necessarily health anxiety, but maybe it's something to do with depression, their mental health. Maybe they are the most unwell, but you will see these people over and over again. And so that's normal. And so if you do need, until you are managing to get the best of this yourself, if you do need this continuous reassurance from a doctor, if you do need to have a conversation with a doctor that you trust, because it's a very easy place where trust can be broken as well, then you should book in. You should speak to people, because this is what we expect.
That's okay. That's okay.
Yeah.
And that's okay. It's not. Some people say reassurance is bad, but it's not. I think some people view it as a bit of a weakness, but that could stem from childhood. It could be stuff from childhood, or as a teenager that they think that they shouldn't seek reassurance from people. But that's still important for your recovery. It's fine to ask, "Am I going to be okay?" Yeah, absolutely. That's not a weakness, but things take time, don't they? It takes time. You just got to be kind to yourself along the way. But I think I think people. Somebody asked me the other day, "How long do you think it's going to take?" Which is it's a really difficult question to answer. But I said, how did I answer it? So in terms of recovery, I didn't really know the person, but I said, because I've not met them yet, but I said, it comes down to your goals, your values. So, for example, my recovery was working, exercising, seeing friends. I know I'm on the right, that's when I knew I was on the right road. So recovery looks a little bit like that. You're normal, you're returning back to normal routines. And I think as well, I'll try and quickly touch on stress, which is probably going to be another podcast. People shouldn't really fear stress. It's a difficult one, really, isn't it? But I think if you fear stress, I think for me, you're reinforcing that. Obviously, managing stress, you don't want to be in constant stress all day, all week, do you? But I think it's, again, your brain needs to feel stress to make, to ensure that it's not going to send any of these mixed signals. So don't fear stress. But I think that's another podcast.
Yeah.
What do you think about that? What's your thoughts on that?
Your body's adaptive, like everything. Yeah. I mean, you do weights at the gym. You told me today that you've seen some improvement. That's because you put your body under stress, and so it adapts, and so it grows muscle, and so it gets better. A lot of people after the COVID pandemic, as soon as they came into any contact with anyone, got a cold, and that cold was much worse than they used to have. They were ill for 10 days because their immune system hadn't had any stress to it. It's the same with general stress in your life. You need it to improve your resilience, so that if something horrific comes along, you have the tools to manage it. But it has to be in control. If your stress is completely out of control and your autonomic nervous system is going mad, and you're having symptoms of anxiety and panic attacks all the time, that's not good stress. But if you do difficult things in the day, to push yourself, then heaven forbid something traumatic actually happens in your life, you know what that is like, or at least you're giving yourself a good chance of managing it when something terrible comes along.
And recovery, and that helps with recovery, doesn't it? That was really good. Well, good summary. Do you want to talk about anything else, or do you want to round things up?
No,
that was brilliant.
I think we've done half an hour. I think.
I enjoyed that.
Yeah, so did I. I think I don't know what my takeaway would be for health anxiety. I think one, it's difficult, it's awful, it's something that I wouldn't want to have to go through. Two, there is a recovery, there is improvements, you will get better if you're able to do the right things. And it's about having the right people around you, and it's about having the motivations and doing the right stuff. And we've touched on a few ways of that. And it's this up and down, and you can get frustrated, but you can get there. I think that's the message that I would want to send out.
Recovery is definitely possible. And, these, again, just echoing Dr. Will, once you've been checked out by Dr. Will and everything's safe, well, I think people worry, don't they, about these sensations that the brain's giving the body, which we've said can, it's not something that might last 2 minutes. It could last for a full year. Muscle twitching, tension, headaches. I probably missed tinnitus. There's lots of symptoms, Will, isn't there? But I think just be kind to yourself, and they can last a while. And health, as Will's touched on, it's really hard, health anxiety, and it might not make sense to you now, but recovery is possible. So hopefully you've all taken away something from the podcast today.
Yeah, but unbelievably difficult on your own. You need to get the support.
So don't be on your own. Yeah, do it. Hopefully you've got us on the podcast as well. I'll just shut that off and we'll catch up.
Yeah, perfect. Bye.